Hey folks, it's Dr. Mike back here again. I told you I was going to get 4 or 5 of these in now. Now, I know you guys are wondering, well, Dr. Mike, when you change your clothes? Well, folks, I'm getting 4 or 5 of these in at once. And I'm just trying to keep it light because I realize we got a lot of things going on in the world today. We got a lot of stuff going on. And it's better if we can learn to keep a smile on our face and be upbeat because, folks, we're all in this thing together. And we all got to make sure we get there together. So if you don't mind, I'm going to go over tip number 5. Now, again, this is our medical exercise training 101 ebook series. If you want to get a copy of the ebook, it's 100% free. Go over to met101ebook.com or look down below. And we're on tip number 5. How are MET services different than physical therapy? Now, folks, I'm a physical therapist. I'm a Howard University graduate where I went to physical therapy school. I've been a therapist now for 30 plus years. And when we started, myself and the other physical therapist that was with me along the way, we wanted to be squeaky clean to make sure at no point along the way was the medical exercise specialist trying to take the place of, trying to replace, trying to do the same thing or compete with the physical therapist. Medical exercise training is not about trying to provide any treatment. You don't use the term patient. You don't use the term therapy in any way, even exercise therapy or fitness therapy, and you don't use the word treatment. You're providing an exercise program. So if you would, indulge me for a second so I read through this one. Medical exercise training does not provide any aspect of medical treatment, including heat, ice, electricity, joint mobilization, etc. These services are provided by a licensed physical therapist or chiropractor. Physical therapy is used in the acute and subacute stages to reduce inflammation and restore function. And also, folks, in the chronic stages, where we're seeing a reduction of chronic stage utilization because of the cutbacks in insurance reimbursement. With the changes associated with insurance reimbursement, physical therapy now is primarily focused on the acute and the subacute injury management. Medical exercise training begins where physical therapy leaves off to a degree. You may have a client that's finished with physical therapy, but they're still having some acute signs and symptoms. And even though the insurance carriers cut the client off, doesn't mean necessarily now you can work with that client because they still may not be medically stable. They still may have red flags, and they still may need to go back to the doctor, therapist, or chiropractor. So it's still incumbent upon you, the medical exercise professional, to assess the client and to be cognizant of red flags that indicate the client's not ready. Just because they were discharged and the therapist or the physician sent them to you still doesn't mean they're ready. It just simply are the circumstances we're stuck with nowadays. Now, as a medical exercise professional, you're not equipped to manage a client in the acute or subacute stages. You're not, folks. I'm sorry. Now, if you also have a license as a massage therapist or some other areas, maybe yes. But for the most part, and I've trained medical exercise specialists now for 28 years, you're not geared, your training is not geared toward providing acute and subacute services. The niche for the medical exercise professional or medical exercise training services is focused on the client above the subacute stage. So they're past or beyond the subacute stage. I should have said beyond rather than above. Physical therapists are specifically trained to provide rehabilitation services using assessment and treatment techniques. They work with a wide range of patients, and there is significant overlap between PT and MET with regard to exercise. When a client enters the chronic stage of their condition, many of the exercises the physical therapists are doing look exactly like the exercises that you'll do in a fitness setting. And exercise is just simply exercise. Now, with that, physical therapists work with a wide range of patients, and there is significant overlap, as I said before, between these techniques when you're looking at the client in the chronic stages. As a medical exercise professional, it's important you understand your scope of practice and your role. Physical therapists can be a large and significant referral source in your practice. When you approach a physical therapist, make sure you clearly articulate your scope of practice as a medical exercise professional and how you can assist or work with them in improving a client's level of function after they've been discharged from physical therapy and or chiropractic care. Establishing and maintaining good rapport with physical therapists in your community is essential in building a strong and profitable practice. Now, folks, if you get a chance, go over to our MedX Pro network. And we have an interview there with one of our MESs, longtime MES and a good friend and colleague, Susie Dutke. Now, Susie is a dynamo of an MES. She's from Lake Bluff, Illinois, and she built a medical exercise training practice and then hired physical therapists to provide physical therapy services. So she had these two services in the same practice, but they were separated in that the therapist provided therapy services and she provided the exercise services. They didn't mix and mingle the two, so they kept it squeaky clean. And with that, Susie was able to make sure that everyone coming in, every client coming in for medical exercise training understood they were getting medical exercise, but also the physical therapy clients realized they were getting physical therapy services. And the therapist clearly understood their role. Susie, as a medical exercise specialist, clearly understood her role. And it worked out and worked out exceedingly well. So there is a distinct difference between physical therapy services and medical exercise training services. We've been offering now the medical exercise specialist certification for 28 years. At no point along the way has it ever been a thing where the MES takes the place of, replaces, or provides the same services that the physical therapist does. Physical therapists are licensed. It is a very vigorous and stringent education, but a great education. But with cutbacks and insurance reimbursement, we will need more medical exercise specialists. So please come back and see us again for our next tip, tip number 6, and all the best in building your medical exercise training practice. Take care.